Hi, and welcome to today's Parent, where we connect you with experts and provide you with information to make your parenting journey a bit more easier. My name is Christine Casina, and I'll be your host for today. On today's show, we'll be talking about infertility. Did you know that 1 out of 5 couples struggle with infertility? It's something that we don't need to struggle with in silence. The stigma around it is immense. We want to provide you with the support that you need. And in the studio today, we have Dr. Kireki Omanwa. He's a fertility specialist and an obs-gyna who's going to provide you with information that will be for sure of help to you. So let's start with the very beginning as well. What are the causes? Let's start with generally the causes of infertility, and then we can cover the causes of infertility in men, and then we can do the women part.
Maybe we can start by maybe having a brief description of what infertility is all about.
Right.
Because according to the World Health Organization, infertility is basically the inability to have a baby. And that is divided into two. There is primary infertility,
right,
where basically a couple are in a relationship and they plan to have a baby. They have regular intercourse 2 to 3 times a week.
Right.
They are not using any contraception, and 1 year has passed and there is no conception, there is no baby. Now, there can also be, or there is also what we call secondary infertility,
right,
whereby this couple have had a pregnancy in the past, or they actually even have a baby, and they are trying to have a second or a subsequent pregnancy, and it is not happening. Again, the same parameters apply, whereby you're having regular intercourse 2 to 3 times a week. There is no contraception, and the lady is not breastfeeding, because sometimes breastfeeding can actually be can actually be sort of contraception.
Right.
Yes. Now, when we start talking about the causes of infertility can actually affect the ladies, it can affect the men, it can affect both, or sometimes we have a situation whereby we actually don't know what the reason is. When it comes to the ladies, let me start with the ladies.
Let's start with the ladies.
Ladies, because ladies first, as we have been taught. There are many reasons for infertility. In this part of the world, sub-Saharan Africa, one of the biggest problems of infertility is actually blocked tubes. Why? Because we have a lot of sexually transmitted diseases, and one of the main reasons, actually, one of the culprits is basically chlamydia infection. And unfortunately, chlamydia, which is sexually transmitted,
right,
has no symptoms at all.
So a couple really know, somebody wouldn't know.
They wouldn't know at all. So it will be a question of, we've been trying to have a baby, we've been trying for X number of years, and until they come and we do a diagnosis, we take this patient to theater, maybe do what is called a diagnostic laparoscopy. They are typical signs of chlamydia infection. But that notwithstanding, the other reasons, the other causes are blocked tubes. You may have blocked tubes, and the tubes can they can be blocked, or they can be blocked and have some fluid in it, what we call hydrosalpinx.
Right.
That is the biggest problem. Apart from that, surgery sometimes, when after a patient has had surgery.
What kind of surgery?
Abdominal surgery, or what we call pelvic surgery.
Okay.
And let's say, for example, there is what we call an abscess, that is an accumulation of pus, and once that has been cleared, the process of healing, when it starts, it can actually lead to blocked tubes.
Okay.
And so on and so forth. That is one of the biggest reasons in this part of the world. However, in Europe, where I was working, the bigger problem is basically age, whereby over 35 years, or once a lady crosses 35 years, the chances of having a baby, getting pregnant, actually start dropping. We are seeing that also creeping into our society these days, because ladies are going to school, after school, university, they want to get on the professional ladder, and once they've reached, the pinnacle of their professional life is when they want to start having babies. And by that time, they're over 35, so actually their chances of success
becomes lower. So a lot of women are delaying childbirth.
Absolutely. Now, the other reason in this part of the world, basically a problem which is connected with women of African origin is fibroids.
Fibroids.
Fibroids, yes. The issue is not so much as the fibroid itself, but the location. You may have what you call intramural fibroids, whereby the fibroids are in the muscle of the womb. Not a very big problem unless that fibroid actually has contact with what you call the lining or the endometrium of the womb.
Right.
The bigger problem is when we have this fibroid in the lining itself, what you call submucosal fibroids.
Okay.
That can be a problem, and it is a problem because, number one, the cavity or the space whereby the embryo does implant and the pregnancy, starts growing is actually distorted, and this can lead to implantation failure. We have issues connected with what we call endometriosis. Endometriosis is basically a situation whereby the lining of the womb, which is called the endometrium, actually finds itself outside in other places, what we call ectopic places.
Right.
This can be either on the ovary, it can be on the tube, it can be actually on the intestines, and so on and so forth. And this actually has a connection with the immune system, and it can lead to infertility. Not to talk about polycystic ovaries as well. About 30% of the patients who have issues with infertility actually may have what we call polycystic ovarian syndrome, which can be characterized by having, number one, irregular periods, issues with the libido, issues with increased male hormones, and so on and so forth. So that is also a problem that we are seeing. We are seeing issues. We are seeing problem with what we call premature ovarian failure, whereby there's a young lady, okay, about maybe let's say mid-20s, early 30s, but then her ovaries are not functioning the way they are supposed to be functioning. They may not be having what is called a good ovarian reserve,
okay, and
because of that can be issues with infertility. We have issues with medical now. Medical problems, things like high blood pressure, diabetes, things like
obesity.
Obesity is an issue as well. Obesity is an issue as well. Things like what we call autoimmune diseases, like rheumatoid arthritis, issues with the hormones, the thyroid gland, and so on and so forth. All this can come in. And then apart from that, we have sort of moved away from our lifestyle.
Right.
How we eat, what we drink, and so on and so forth. So we are seeing cases whereby we are eating more processed foods.
Yeah.
So you go to the supermarkets where food is processed, and we know that in the processed foods there are chemicals as well.
Right.
And unfortunately, the more we eat of these processed foods, they tend to lead us to obesity, and because of this, we have issues, health issues, and consequently we have issues with infertility. Drinking is a problem.
Alcohol is
but
how much alcohol?
How much is now that is an interesting question. Well, I mean, taking a glass of wine should not be a problem. According to NICE guidelines, which basically are used in the UK, a glass of wine, glasses of wine is not an issue. But now when you start taking a bottle of Mtembeaji or whatever it is, then
oh, you mean Johnny Walker?
Then actually that becomes a problem. And actually we have started seeing ladies drinking as much as men. And that is an issue. So there are quite a number of these issues at all. There are some other questions, some other reasons is basically social, economical issues. You find, yes, a couple is married,
right,
but they're living apart.
Because of work and other reasons.
Because of work and because of other reasons. The husband lives abroad or lives in another town and so on. So meeting in order for them to actually procreate becomes a problem, because they can try to do timing that now these are my fertile days, and maybe the husband doesn't get an off. So it becomes a problem. So these issues are there in the society, and they're actually leading to infertility.
Starting from the beginning where you mentioned about STIs, I'm just imagining if chlamydia doesn't have, the symptoms, we can see them. So how do you know? How do you know when to, to come be checked? And
I think number one, maybe the best thing is to do zero grazing. Can I use that, zero grazing? Have one sexual partner. But then the fact that you have one sexual partner does not mean that your partner
is zero grazing.
Is also zero grazing. Zero grazing. So I think that fidelity to one partner is very important. Because
so when it comes to matters STI,
of course. Now, because chlamydia has no symptoms at all, we only come to know that actually this is chlamydia by secondary means, meaning by going to diagnosis, especially for ladies, taking the when we take these ladies to theater and put a camera in the abdomen, you can actually see the signs of chlamydia, because we have what we call adhesions which are around the liver,
right,
adhesions in the pelvic region, and so on.
Okay.
Which is usually, okay, now, yes, we have this problem, we have to sort it out. The tubes are blocked, and there's nothing else we can do. The patient has to go for alternative, treatment in order for her to get pregnant.
Thank you, Dr. Kireki.
Yes.
When we come back from the break, we are going to talk about treatment for matters infertility. Please stay tuned. Dr. Kireki.
Yes.
We've talked about causes of infertility when it comes to women.
That's
what about
right.
men?
Now, in men, it's interesting as well, because we also have blocked tubes as well.
You have issues of blocked tubes in men?
Blocked tubes as well, because normally what happens is that sperm is produced elsewhere, it's stored elsewhere,
okay,
and during intercourse, that sperm has to travel through some tubes before it comes out as an ejaculate. Now, because of different reasons, could be infection as well as sexually transmitted diseases that we talked about, undetected sometimes, or even sometimes detected,
but ignored.
Okay. With the issue that, there are symptoms. There is pain during urination. They can even be passing some pus, but you hope that this will clear by itself.
Yeah.
Yeah. So what happens is that this infection actually ascends and it actually blocks the tubes. So a sperm doesn't come down, and we have what we call azoospermia, lack of sperm. But sometimes there can be an issue with the production of sperm itself, which fortunately is a small percentage.
Okay.
We have issues with surgery. Say, for instance, what we call undescended testes, whereby the testes have not gone into the scrotum as they're supposed to be. So this can actually lead to infertility, because then there is no sperm which is produced,
okay,
or the sperm that is produced is very poor quality. And if that testis is left, or those testicles are left in the what we call the inguinal canals, they can actually lead to cancer in future.
Wow.
So there we go. Blocked tubes, undescended testes. We have issues with surgery.
Yeah.
Sometimes when there is correction of what we call hernias, inadvertent, blockage of the tubes can also occur. We have issues with trauma. Gentlemen, we love, these hard games, football, cricket sometimes, rugby, and so on, or taekwondo, and so on. So sometimes you watch on TV, a ball is hit and it hits somewhere, and you actually feel pain for that.
On their behalf.
On their behalf. So that can also be an issue. We have issues with genetic diseases, whereby there is what we call microdeletion in the Y chromosome. The Y chromosome is what determines that actually this embryo is going to be male.
Right.
Now, if there is what you call microdeletions, you find that these males will actually not produce sperm. They are azoospermic.
So you're saying that fertility issues in men, I don't know if possibly even for women,
yes,
could be a genetic, an inherited thing.
It can also be inherited. And actually something interesting, I think last year we went for a conference in one of the European cities, and there was a paper which was presented that actually some of the cases whereby the male was a factor in infertility, And they actually ended up having boys after doing IVF. They followed these children up, and when they became mature, these children also had issues with infertility. So yes, there is an element, there
Of
can be an
heredity,
element of passing on this problem.
And we never think about it that way.
No, we don't.
We never think
we
about it
don't.
that way.
No, once you have that baby, you're happy about it.
Yeah.
And especially if it's a boy,
The expectation
now,
somebody will carry your name.
Exactly. And society is happy about it, and we are all happy about it. We have issues again with the so-called, let me call it plumbing, the way the pipes are connected. Because ideally, when you're having intercourse, when a man has orgasm, the sperm should come out. But then sometimes this sperm does not come out at all. It can go back into the bladder, what we call retrograde ejaculation. Just because there's a misconnection or an improper connection there, the sperm goes back into the bladder. Sometimes these men don't ejaculate at all. Everything is okay.
How do you know when you're not
problem.
ejaculating?
What we do is when these gentlemen come, we ask actually their medical history, and the wives are also very, very helpful. I've had several patients who come and say, you know what, my husband does not have an orgasm at all. And then now when you start talking to the gentleman, you find, yes, actually that doesn't happen, and so on. Issues, smoking, a very big problem. We know that cigarette smoke has about 3,000 chemicals. And some of these chemicals are actually going to affect A, the production of sperm, and B, the quality of the sperm. Some of the elements, some of the chemicals which are in a cigarette smoke can actually go and replace some of the elements which are in the sperm, meaning that they will not be functioning the way they're supposed to be functioning.
Right.
So that is why smoking is actually a no-go area when it comes to infertility. Drinking.
I was just about to ask you, you're not going to touch on alcohol for men?
It goes without saying. And I think Kenyans love their drink. You can take one drink or two drinks. I'm not here to tell people to drink, but for those ones who drink, maybe a drink or two could be okay. But after that, 3, 4, 5 drinks, you'll not be able to function at all. So in as much as you have all the bravado is just to show people. But when it comes to matters, fertility,
you have to limit
it's a no-show.
On today's show, we are talking about fertility. We've touched on matters, fertility when it comes to women, what causes infertility when it comes to men. We'll talk about treatment when it comes to fertility. We got a question from Scholastica in Kakamega. Her question is, what is secondary infertility? Dr. Kireki, if you could expound. Okay. We have something like secondary infertility?
Yes,
Explain.
Definitely, and it is something that is known. As I said right at the beginning, there are 2 types of infertility. There is primary and there is secondary. I think what Scholastica is asking about is that she may have a child, or even she may have several children.
Right.
And she wants to have another one.
Right.
And they're having regular intercourse 2 to 3 times a week. She's not using any contraception, and she's not breastfeeding. And a year has passed, and she's not pregnant.
Right.
That is what we call secondary infertility.
So that inability to get your second, third, fourth, fifth child,
subsequent child or pregnancy.
Right.
That is secondary infertility.
What are the causes?
The causes can be actually the same.
Just helping couples manage, it's an emotional journey.
Absolutely.
And it's something that we need to be more sensitive.
Absolutely.
How we speak to couples, even without knowing that they're struggling. Yeah. How when we're asking, where is the baby?
Yes.
When are you getting pregnant?
Yes.
When am I getting grandkids?
We have to be extremely sensitive, because some of these patients, they have seen doctors, they have issues and so on. So they are on a journey, but you don't know where they are on this journey. So starting to ask them, when is this baby coming? When am I going to be a grandmother? Or, and so on and so forth. We should actually be very judicious when we are talking to them. Absolutely.
I hear you.
Yes.
Let's talk about, and I know it's a big factor for many couples.
Yes.
Treatment. I've come to your clinic. You've told me we have an issue.
Yes.
And now I need to seek treatment. the average cost of treatment, I know could be a factor for some people. But let's just talk about the estimate.
Yes. Now, as I said in the beginning, the treatment will depend on the diagnosis. So if the tubes are okay, sperm is okay, before we have to start right at the bottom. You can say, you know what, we can do what is called timed sexual intercourse. We monitor how your follicle is growing and the maturity of your egg and so on and so forth. So that is also treatment, which is basically very straightforward, not very expensive.
Okay.
Now, if you do that and it doesn't work, then we can escalate that to the next step by doing what is called IUI. IUI, intrauterine insemination. We do the same monitoring of the follicle and so on.
Okay.
And once you're ready, your partner gives us a semen sample, we clean it, and then we inject it into the womb. IUI, yes. Costs anywhere between 30 and 50K.
30 and 50,000. So that is IUI.
IUI, that's right.
I'm waiting for you to get to IVF.
And that's where I'm going. Now, when we have a problem either on one side or both sides, and this problem, or let's say we've moved from timed sexual intercourse, it hasn't worked, we've gone to IUI, it hasn't worked, we've done several of them, they have not worked, then the next step is IVF. IVF, unfortunately, is expensive. And it varies anywhere from about 400,000 to anywhere between 600,000-700,000, depending on where you go to.
So between 400,000,
700,000
onwards.
Yeah, for one cycle of treatment. Now, why is it expensive? It's expensive chiefly because of the medications that we use, the consumables that we use, the expertise that is needed, theater, and so on and so forth. So, and remember, every clinic has its own markup, and the pharmaceutical companies have their own markup, and so on and so forth. So, that is a huge bottleneck for patients to access treatment.
Because you can imagine at 400,000, 700,000, do you know of any? I mean, we need to get to a level where it's covered by insurance. I've not heard of any insurance
which is fantastic.
That covers.
A very good question, because number one, the Constitution actually assures us that every Kenyan has a right. So if it has a right, every Kenyan has a right, it means the government should actually do what? Should actually step in and actually provide that access. And
possibly make it affordable or...
Thank you. Obviously, it's not doing that. NHIF is doing some bit, but the bit it's doing is that it is providing this treatment, but only to a small percentage of the people who actually should have access to it.
So how is that decided? As you're winding up, your top 3 advice to couples who are struggling with fertility, what would you tell them?
Number 1, come for help. This help is available. Number 2, don't struggle alone. There are many couples out there who are having the same problem. Number 3, God willing, we will help you, because we have these skills, we have this knowledge, and that is why we are here. So don't isolate yourself. Come out, and we'll try and help you as much as possible.
Dr. Kireki, thank you very much.
You're welcome.
Thank you for watching today's show. On today's show, we were talking about matters fertility. As we said at the beginning, 1 out of 5 couples are struggling with fertility. It's something that you don't need to struggle with alone. There's help out there, and that is why we had Dr. Kireki Omanwa on today's show. We are here at Little Cribs, the home of exciting, fun, and durable furniture. Make sure you check them out on Facebook and on Instagram. My name is Christine Kasina. I have been your host for today. And for parenting resources, go to www.supermamas.co.ke. See you next time.